Hello and welcome to another episode of Purvis Versus. My name is Eric Purvis. I'm a massage therapist, course creator, continuing education provider, curriculum advisor, and advocate for evidence-based massage therapy. In this episode, we welcome Dave Cordoviz, who is a new RMT in Vancouver, BC. Dave and I have an engaging discussion on his journey through RMT school and what it has been like growing a practice. Dave shares with us his thoughts and feelings about what he appreciated in massage school, as well as what he feels could be improved upon. If you enjoy this episode, please rate it and share it on your favorite social media platforms. You can also support my podcast by making a donation at buymeacoffee.com/helloob. Purvis Versus can also be found on YouTube, so please check us out there and subscribe. So thanks for being here, and I hope you enjoy this episode. Hello, everybody, and welcome to another episode of Purvis Versus. I'm excited here to have Dave, is it Cordoviz? Is that how you pronounce your last name?
Absolutely, yes. Dave Cordoviz.
Who is a relatively new RMT, practicing at numerous locations throughout the Lower Mainland in BC. So he's here today just to talk to us a little bit more about kind of his experience of being a student and what it's like being a new grad and building a practice, and the kind of learning journey that we go through when we get out of school, pass our board exams, then we head out to the real world. So I'm hoping he's going to give us some insight into what his personal experience is like. So before we start, Dave, today, just tell us a little bit about you.
Yeah, so my name is Dave. I'm a recent grad. I've been practicing for about 6 months now. I finished the board exam 2022. Currently practicing in 3 different clinics. I really wanted to get myself busy and just really engross myself into the RMT world. Yeah.
Nice. So 3 clinics. So are you working, do you get any time off, or do you sleep in the office?
No. Actually, to be honest, right now, I'm currently working 7 days a week, but I'm actually going to decrease 1 day because I also work at my family's restaurant too.
Oh, really?
Yes, yeah.
What's your
That's more
family
on the side though. It's just like a small Filipino restaurant out in North Delta.
Oh, nice.
Yeah. So I do that. That's like my job before I went to RMT school. Mm-hmm.
Nice.
Yeah.
You should put a plug in for the name of the family restaurant.
Yeah, absolutely. It's called La Mesa Grill. Yes,
Nice.
fairly known within the Filipino community, but it'd be great to have more people there actually.
Perfect. Okay, sounds good. Well, next time I'm in the Lower Mainland, I'll have to come check that out. I love Filipino food.
Absolutely.
I love all food, actually. So yeah, I live in Victoria, so we don't really have I don't know if we even have a Filipino restaurant here on the island.
Yeah, I don't think so. We do get a number of customers within like Vancouver Island. They're like, "Oh yeah, we're from the island. We love you guys."
Yeah.
Yeah. we have fans. We have fans.
Yeah. Excellent. So the 3 clinics here, are they how many hours are you working at each clinic? Like, that's like 7 days a week as an RMT. I'm sure a lot of people are listening thinking this guy's freaking crazy. Like, but you're new, right? You got to pay off your debts and you got to build a practice. So we're willing to sacrifice a little bit. But how many hours are you working every day on average, like seeing clients?
Oh, yeah. So I'm starting to get a lot busier now. I'm actually only working 6 days a week as an RMT. So I'm doing 3 days in one clinic, 2 days in the other clinic, 1 day in one clinic. The clinic I'm working in right now is my main one. This is called Aries Physiotherapy. This one I work, hard to say. I'm available like 9 to 4 and then 10 to 7 and then 8 to 1. But the thing is, as of right now, I'm not fully booked yet. I want to say that I'm getting about 20 to 25 hands-on hours per week on average these days, and then I'm getting about high 20s to like low 30s patients per week.
Well, that's pretty good. That's pretty good.
Yeah.
So you haven't really found it difficult then to build a practice? Like, in 6 months, you're pretty full, I would, more so than not.
Yeah, fairly busy actually. Especially I've heard from a lot of people that as a guy, it tends to start off a little bit slower. I did find that January, February, that was kind of the case, but the new clinic I'm working at, the one in Burnaby, it's close by a hospital, so I tend to get a lot of repeat patients there. With this clinic, working with ICBC patients a lot, which I definitely enjoy. I get a fair bit of consistent patients as well too.
That's good.
Yeah. But I'd like to think that I like to think that some of like the massage styles that I go for, or at least like how I make people feel, kind of gives them that opportunity or like that desire to come back.
Right.
Yeah.
Well, you're doing something right always. If people are coming back and they're happy, right? That's usually the
Yeah.
thing, right? If it's the one and done person, it happens sometimes. But if you're getting a lot of repeats and referrals, and to be full early on is great. I'm not really sure what it's like throughout the rest of the country, but I know here in BC, particularly in the Vancouver Island and the Lower Mainland, it seems like it's most people I talk to it's pretty easy to build a practice. Is that the case with a lot of your classmates too? Like, have you found that they've been able to build a practice pretty easily?
Oh, I find that it's actually so different. The people that work within the Vancouver proper or Vancouver city itself, they tend to be very busy. Like I know one person who was telling me, I think a few months ago, she was already hitting like 30 people. Some people have like wait lists already, but then some of my other friends, they're also available 5, 6 days a week, but then they're getting about, I don't know, 17, 18 patients per week. So it really depends. Yeah, I find that as you get closer to the suburbs, it's a little bit harder. There's a fair bit of RMTs now, I find. Yeah, especially working in multidisciplinary clinics. So yeah.
Yeah. Well, it's funny. When I went to school 20 years ago now, I think there was about 1,300, 1,200 RMTs in BC, and now there's
Oh,
like, I think there's almost 6,000.
yeah,
It's crazy.
yeah.
So in 20 years, was that a five-fold increase in therapists? That's crazy. And the thing is I remember when I was in school in the 1,200, I remember being told by some of our instructors who said things like, the market's saturated, you're a male, you're going to struggle. And I remember being so scared. And you know what? But people have been saying the same thing forever. And I don't know how true that is, because whether you're male or female, most people tend to be pretty busy,
Mhm.
more or less, at least here in BC. And they keep saying that the market's saturated, but they keep adding more therapists out there, and people keep filling their practices. So I don't know. I don't know if
Yeah.
there's much to be said with all those kind of scare tactics and fear mongering. I think is some of the things that that's how I felt anyway. I felt scared.
Yeah, I really don't know because when I was first looking at clinics, there were some clinics that have 22 RMTs. It's wild, but then a lot of those people are actually fairly booked too. So hard to say, but yeah, some patients like, for example, one of my patients today told me that she's looking for a new RMT because the one she normally sees, she hasn't been able to see him for over a year now.
Wow.
So hard to say. Yeah, hard to say, hard to say.
Well, it's a good industry to be in, I think, in terms of if you can be young, relatively quick to get through school, and you get out there and make a living pretty quick. Uh,
Absolutely.
but yeah, it's that's good. I'm happy. That's good. I'm impressed to hear that. So I just wanted curious about your. You don't have to tell me where you went to school unless you want to. I'm just kind of curious about your experience as an RMT student. Can you tell us a little bit about, like, just what was your experience? Did you like it? Dislike it?
Yeah, so regarding that, I feel like it's such a split. I definitely enjoyed my time at my school. I went to Langara. Um, it was different from my past experience because I have a Bachelor of Science in Biomedical Physiology and Kinesiology from SFU. And my experience from that school was very, very different from Langara. Like I was coming in with an experience in having like 400 people in one class. But in Langara, we have at most 2 dozen. And I think by the end of the program, we had about like 18, 19 people. So I really enjoyed the aspect of closeness was able to get with my classmates, with my friends, as well as just getting to really know the instructors and asking them how their practice is, like what are some things that they do to kind of like better themselves as clinicians, like how do they take care of themselves. So I thought that was a really nice experience. To have instructors actually know your name to me was such an unusual concept too, and I definitely appreciated that. And a few of my other friends who also came from like UBC or SFU basically had the same thought process as well, where it was such a closer knit sort of experience as a student.
It's
Yeah,
more of a community, right? Like when you go to massage school, it's like you get this kind of sense of community because everybody knows everybody, and it's almost like a little bit of everyone becomes a little bit of a family or extended family.
exactly. Yeah, and that's definitely something that I do appreciate. A lot more closeness.
Yeah, yeah.
Yeah, yeah. But that said, there were certain things about school that I wasn't really the biggest fan of. Like I don't want to throw, like you said, like I don't want to throw anyone under the bus. But yeah, I mean, I like to think that I'm a very opinionated person, unfortunately, but
That's why
yeah,
I
there's
wanted you
certain
on
things.
here, Dave.
Yeah, there's certain things I didn't really like in terms of like the subject it is that we were learning, or just certain classes that made me go like, was there ever really a point in this? Because like I didn't really see the relevance in clinical practice. Yeah.
Did you have any specific examples that you want to give, like of something that you're like, why am I doing this?
Oh yeah. So definitely there were certain classes which I think was weird. I still think is weird. Is for example, we took a nutrition course,
Hmm.
which yeah, that took about like 3 or 4 classes. Which in my head, I'm like, I thought we're not allowed to talk about nutrition at all as RMT. So why are we taking this? Or certain science, I mean, it's hard to say. Like it's good, I find that it's a good idea to really learn about anatomy and physiology, but then to a certain extent some of the detail that we did learn is a little bit like, well, it's not really relevant to clinical practice. Because one of the things that I kind of figured out about RMT school is that they constantly tell you how hard it is. Like that's something that everyone says, like, oh, it's so hard, you're gonna be burnt out, you're gonna be exhausted. And honestly, that's absolutely true. But I think that there were certain things that they could have done to make the program a little bit easier, or at least more concentrated towards actual clinical practice.
Right.
Yeah.
A lot of filler course.
Yeah. And I feel like having filler is not necessarily bad, but I think there were other courses we could have taken, or certain courses we could have taken longer, that would have come out a lot better for us as clinicians.
I would 100% agree with you, and I think this is an argument that gets used often when people are. Because one thing I'm big advocate for is like changing the curriculum or updating the curriculum, making it more evidence based, and ideally for me, I would love to see it in a university system, but that's a lofty dream.
Yeah.
Who knows if that's going to happen? But the I've heard so many times from so many different organizations and associations and schools is that, well, we can't increase the length of the program, and I think, well, you don't necessarily, if you're going to keep it in a private school like it is now, you don't need to lengthen the program necessarily, although I think it'd be great. But there's so much stuff in there that you don't even need to learn about. Then why don't you add that on to something, like you said, more clinically relevant? Like you're talking
Yeah.
um like nutrition, like that's not even our scope of practice. Is it good to know something about nutrition? Maybe, but is that, like, do you need that in your schooling? Probably not. That's, 10, 12, 15 hours of schooling that you could put on something else. Do we need to know the details of like cell division and the reproductive system, or like embryological development of different tissues? That stuff's kind of interesting, but is it something that you need to know for your entry to level practice? Like, is it, how much detail do you need in those things? And if I look back at the stuff I learned in school, I think there's so much stuff we learned that was just totally unnecessary. And I would have loved to learn more kind of clinical applicable skills or
Exactly.
knowledge.
Exactly. Yeah, no, I completely agree. Like, I don't think therapeutic exercise was really emphasized enough. Like, I don't think it was emphasized enough on how to listen to patients, how to talk to patients, Like, yes, we learned pathology, but then how does pathology actually look like within a clinical setting? Like, we did gloss over it a couple times, but we didn't really go in depth about it. Yeah.
And I think that I love that you said it too about the pathology. I mean, I totally agree with everything you're saying here. So it's a bit of an echo chamber, but that's okay. It's
That's what we're here for, right? Yeah.
That's what we're here for. Yeah, just to tell each other that we're right. And that's one thing that I'd be curious, and I probably know the answer, but I'm just going to make an assumption here, is that you learn about pathologies, and when I was in school 20 years ago, it was the same thing. You learn about these pathologies, but then when you don't really learn about how that impacts your clinical practice, or what it is that you would expect or would be kind of best practices to work with that population. For example, a simple one would be like osteoarthritis.
Yeah.
What does that present like? What are kind of some assessments to see the severity of the region, whether it's knee, hip, spine, shoulder, neck, whatever. And then what would be kind of like, what's the best recommendations for treatment in home care, right? So obviously massage, there's only so many ways you can massage, but there's all the other stuff that's within our scope of practice, right? Like about, load management or progressive loading, or rather than, like, at least the way I remembered it was like someone's got osteoarthritis, and then okay, these are some of the things that you will see, and then it was basically just like massage them and get them to like do these stretches and strengthening things. It was so vague that I never
Yes.
felt comfortable with any of the pathology stuff in terms of really having a solid understanding. So you think that they could go into so much more detail on that. It would be so much better for everybody.
Exactly, exactly. And I do think that's a lot of kind of like my sort of concerns about it, where yeah, cool, we learned about osteoarthritis, like we learned about rheumatoid arthritis, like certain contraindications, but how do we actually get someone who has osteoarthritis to feel better, to actually live life, as opposed to let's just give you a nice massage and then that's it. And I think from my understanding from my classmates, it's also one of the biggest things is we didn't really know how to treatment plan. We know how to give someone a nice massage for one appointment,
Yeah.
and then after that, it's just like, oh, what now? And I think that's part of also why a lot of neuro clinicians aren't really that busy, is because we just don't know how. Like I had to ask a lot of other RMTs. I had to ask a lot of physios, like, what do you do? Like, how do you do this? Like, how do you tell people to come back? Like, how do you actually make a plan long term as opposed to just saying like, yeah, come back to feel nice.
Right,
Yeah.
especially if they have and then that comes down to something you touched on earlier, I think, which was you were talking about like communication and how to like talk to people and how to,
Mhm.
connect and build that therapeutic alliance. And which is, that's a very difficult skill to
Yes.
learn, and it's hard to do. But if you this is my experience here, is that if you learn how to talk and listen to people and just be more present with them, it makes a much easier treatment plan because they kind of tell you what it is they want to do.
Yes, absolutely. They become a lot more comfortable with you. They start realizing like, oh, I can actually tell this person something and they'll pay attention as opposed to, oh yeah, just go stretch it out. Oh yeah, just go strengthen it, which doesn't really mean anything.
Yeah,
Like
because
it's so easy to tell someone, oh yeah, yeah,
we're supposed to do that. Go stretch it.
exactly.
Okay.
Yeah, it's so easy to tell someone, yeah, you should go strengthen it,
Yeah,
but then why should they care
yeah,
to begin with, right? Yeah.
yeah, and that's a big error. Hey, that and I know that the argument is often entry level practice. Like, well, we're trying to teach people to be safe, and effective and ethical, and yeah, maybe you're being safe. Like someone comes to see you that has some type of pathology, and you're not making them worse, but are you really being effective with them?
Exactly. Yeah.
Maybe, but and you're probably at the very least you're hopefully not making them worse, but how can you be most effective with them?
Hmm.
Which is the thing that from the other RMTs I talked to, and relatively new grads that I've been doing these series of episodes on, and that's kind of there's an overlying theme there, is they just don't feel quite ready to take this information and apply it to practice to be most effective or more effective. It's just like, don't hurt people, watch out for these things, and just give them a nice massage. Well,
Yes.
that's like the very lowest common denominator. I would like to think that we should want to reach higher from our education, right? Obviously, we're going to keep learning as we develop and as we grow as therapists. But you'd think that just pumping people through the schooling to pass a minimum exam is, I don't know, it seems almost negligent to me.
Exactly. And I do think at some points that's what was emphasized is like you have to do this to pass the board exam, this like extremely difficult hurdle that everyone has to go through. Then after that, yeah, you're free, you have free reign to learn whatever. But then it's frustrating because you're paying so much money, you're going through so much mental stress, emotional stress. Your time is dedicated to passing a board exam as opposed to actually dedicated to being a better clinician. I think at its essence, that's what was most frustrating.
Yeah, and that was actually one thing I wanted to talk to you about too. Did you find that was the kind of overarching emphasis of the program, was just to pass the exams, or was that kind of, do you have some instructors that were willing to kind of give you a bit more in addition to then to the base knowledge that you needed to pass the exams?
Yes, absolutely. So I think as a program, the goal is to get as much people passing the board exam as possible. And I do see the business side of that. But the great thing is there were some instructors that were very honest about certain things, such as I had some instructors that would say like, okay, this is probably what's going to be like in the board exam. But if you're looking at actual real life clinical practice, this is not going to be the case. This is what you should look out for. This is what you should be doing. And those are basically my favorite instructors.
Yeah,
Yeah,
the
but
ones that kind of put the extra effort in to like impart their clinical experience with you.
Exactly, exactly. And that's exactly what I wanted to learn in school. But at the same time, I can't really blame the school for that. I can't really blame those other instructors. I just feel like, yeah, sure, we learned what was good for clinical practice, but I mean, that doesn't always translate to what they're looking out for in the board exam. I feel like at some point there's a lot of like checking off, like, yeah, like ticking off check boxes, essentially like, oh, this person can do this, 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 this. But then again, we're not really looking into, is this person being a good clinician, period?
Yeah, and that should be the focus. I always feel is that, yeah, of course you need to pass a board exam because you have to get your license to practice and to, for people to come pay you and, claim insurance. But the focus should be on creating good clinicians because a good clinician will pass that board exam.
Exactly, exactly. And it kind of goes back to like, I don't necessarily, I recognize that school was hard. I recognize that board exam was hard, but I just feel like it didn't need to be that hard.
Right.
Yeah,
They could have made it in a more applicable, more practical, but not so difficult with the wasted time on things that weren't really relevant.
exactly. Exactly. Because at that point, as a student, admittedly, at some point you kind of just don't care anymore. At that point, you just care about passing,
Yeah.
which is like, yeah, that's not the best, right?
What was it like though compared to doing your degree at SFU in terms of the quality or the content of the education? How would they compare?
Truthfully, the anatomy and physiology portions, the physiology were actually not that far, they're not that different. So with SFU, we definitely went into a lot more detail to the point of we were just straight memorizing something. Whereas for RMT school, admittedly, because it is shorter, we just went over like a wider grasp of things. But I remember being impressed, like, oh, okay, like this is pretty legitimate information. Like I remember reading this, I remember I recognized this, I recognized that. So I thought that was great. I do have to say, specifically for Langara at least, the MSAC course was significantly better taught than it was at SFU. I think SFU was a lot of just like memorizing, whereas our instructor at Langara was very good at actually explaining to us the concept. And it basically became a language course. We were learning like how, like yeah, like for example, like brevis. Brevis means short. So anything that involved the word brevis is just a shorter muscle, and it's usually intrinsic. So like little things like that was very helpful. Um, yeah, yeah. So I like that part of the learning.
Yeah.
Yeah.
Yeah, I did when I did my undergrad a long time ago now in the 90s. It was I did an anatomy and physiology component of my program, and I remember it being extremely just not. It was just memorizing. It wasn't nothing applicable to it. So it was much easier. I found when you go into the massage program to learn your MSK, particularly, it was much easier because you're like, oh, this is what these things do, and you're able to touch them and palpate them and move them around. So yeah, you kind of had that, just that it was rather than just this like visual learning, there was a little bit of kinesthetic and applicable stuff with it too, which made it a lot easier.
Yes, exactly, exactly. The fact that so we did the lecture part, and then like a day later we did the actual palpation part. So that one was really nice. Or just like I found that I wasn't really memorizing the muscle actions anymore. I was just looking at like, okay, this is the origin, this is the insertion. What would be the logical movement here if this pulls from this direction? So that was a perspective that I didn't really see at SFU, and I really enjoyed that from Lagera.
Yeah, that's great. That's great. What about things like evidence-based practice? Because this is something, at least when I was in university, everything was like evidence-based. And then you go to massage school, and those terms, at least when I went to school, were never used. Was that stuff ever brought up with you, like this is evidence-based, or was it just nothing there?
Well, this is kind of where it starts getting hard to say because definitely going to a university, there's a huge emphasis on actual evidence-based practice, like or not evidence-based practice, but just being or just looking into good research. Like we were taught on how to look at or what makes research bad, what makes research biased, what makes up a study, what are the components of a study, why would this be more relevant than others, why would this not be applicable for real life, and why would that be applicable for real life? And I thought that that was really great. We were taught to logically think over everything. Like we shouldn't just hear a claim and go like, okay, that sounds about right. And it's more just like really emphasize on what are the sources for this claim? Like what proof does that person have? And that was great at SFU. And unfortunately, I don't necessarily think that that was something that I saw in Lingera as a program. Individual instructors were definitely a lot better about it, but I just felt like the narratives of certain modalities were so pushed through. Like they would talk about evidence supporting those narratives, but what about evidence that would go against those narratives, which, as far as I understand, is just as important, if not more important.
100% agree with
Yeah.
that for sure. Yeah, and that's the thing too that is a problem. We can probably talk about this for a bit here now. Is the you go to school and you're taught these things and you're taught and you're shown that there's evidence, but you're only ever seeing one side of the evidence. And if you have the knowledge or skills, you can often look at that and be like, there's something doesn't quite fit right with these claims are being made by that. And does this paper say what you think this modality is supposed to be doing? Like, and often there's big leaps in knowledge or leaps in logical leaps that people will apply to research and say, oh, well, in this paper, I'm just going to throw this one out there. In this paper, people have fascia, and so therefore that means that when we do these things on people's hands, that we're releasing this specific fascia. Well, it doesn't say that in those papers. Like people will take these anatomical papers.
Yes.
And then they'll use that to support a claim for a modality. Oh, yes, people have cerebrospinal fluid. So therefore, when we put our hands on people's heads, we are manually manipulating cerebrospinal fluid. And then people make those kind of claims. You're like, well, that's not what that research says.
Exactly. And I do think that that's part of my like my hangups on when we started learning those things. Because initially I was like all in on a lot of these things. I'm like, oh, okay, like it sounds pretty legit, sounds pretty good. But then at some point around Sem 4, Sem 5, there were certain claims that were being made in some of these classes that made me go like, wait a minute, I don't really think that makes a lot of sense. And it just kept on going. And I think that's where a lot of my personal frustration started coming from, because yeah, honestly, I don't even think a lot of these classes gave in examples of papers on why those narratives, quote unquote, make sense. It's more just like, okay, this is my theory, and if I can increase this person's range of motion, that must mean my theory is correct. And in my head, I'm like, but there are so many reasons why someone's range of motion can increase temporarily. Like 5 hours down the road, that range of motion is probably going to be back to normal. But then that's never really addressed. It's very much like a before and after photo with no real consideration for actual long-term effects.
Right. So yeah, someone comes in, they're standing crooked, you do massage on them, they feel more comfortable, they're able to stand upright. So therefore you've just like realigned and fixed whatever your narrative is here. But then the person goes away and then like 10 minutes later they're standing the way they were before.
Yes, exactly. And it's just that part was never really talked about. It's very much like let's do a little bit of visceral manipulation here. Oh, look how much more like hip flexion there is now. But you're not really looking at the fact that I can literally turn the light switch off and on and it would do the exact same thing. So yeah, and that's kind of like my sort of personal hang up about it, truthfully. It's just we're not really taught to critique ourselves. And I do think that is extremely important as clinicians that help people, because things can always be better. And I do think it's such an important first step to realize, like just being humble enough to say, like, maybe I'm wrong about this and I should try to fix myself if I do find out that I'm wrong about this.
And that's huge. I like that you said that, humble is that we need to realize that we don't know everything and that we're always learning, we're always developing, there's always new knowledge coming around. But yeah, and this is one of the biggest problems I see in our profession, and is people are taught these things in school by a well-meaning instructor who is perpetuating a untruthful idea, and that then gets taken as fact to say 15, 20, 30, how many students are in the class, and then they go out there and start believing this stuff. And then they start telling that information to their colleagues, and they start telling that information to their patients or their clients, whoever comes to see them. And then it just becomes this kind of this constant perpetuation of like incorrect knowledge. And a lot of people are going to listen to this and have heard me say stuff before, and they're like, well, is it doing any harm? I'm like, well, it might for some people. That kind of those beliefs, those understandings might be harmful, but at the very least, it's wrong.
Yes.
So should we, as a healthcare profession, should we be allowed to be telling people things that have no factual base? Unless we could just say, hey, in my opinion or in my experience, this is what I do, and this might work. That's part of your clinical experience. That's part of the
Yeah,
evidence. But I don't think we should be allowed to, and I don't think it should be accepted that we can just tell things to students and then they just are made to believe it, and then they go and on have their entire career with ideas and thoughts that aren't supported. That just to me seems so wrong, so unethical.
exactly. No, I completely agree. And it's like you said, I fully agree. It's not, I don't see that people are saying these things because they want to take advantage of people. Not like that at all. I just feel like they haven't really gotten that chance to be countered in their beliefs. And I do think part of that is because there's such a huge echo chamber of, as a massage therapist, we can do so many things with our hands. And the idea that we can't, which I'm realizing now is actually such a small minority of people believe that. And it's very unfortunate that it's small, but I it sucks to kind of like talk about it to other people too, because I do also feel like when you bring it up to other people, you're taking it, or they're taking it as if you're trying to attack them. But then you're also not. You're just trying to change people's perspectives, or just just trying to be better, essentially, trying to know better.
Trying to be less wrong is a term I always like to use.
Exactly. Yeah. And I do think that's one of the things that we don't really talk about much is that science is not really it's not like a group of just like old people deciding like, oh, this is right, this is wrong. Like science is a way of looking at things. It's a way of observing things. And whatever science says now is based out of our current evidence. So whatever science was saying 20 years ago was based out of that current evidence. And I don't necessarily think that it's wrong that people used to believe those things. But now that we have the ability to know better, I do think that we have a responsibility, like you said, to be better. And we have a responsibility to actually teach patients better because they've been told for so many years now that so many things are wrong with their bodies, that they're gonna break down, that they're not gonna be able to like be active anymore, they're not really gonna enjoy life. Like, oh yeah, you're definitely gonna have surgery in a year. And honestly, that's for most people, that's not true. It's not true. And it kind of hurts. It hurts me to hear that from some of my patients too. Like being told that, yeah, like I can't do squats anymore and I can't go hiking anymore, or I've been told that I'm gonna be in pain for the rest of my life. Like that's so disheartening. And I do think that not just as RMTs, but as clinicians, we can do so much better than that.
For sure, for sure. And that's the thing was what happens is when we have this I don't know what the proper term is. I'm just gonna say it's a negativity bias where as a clinician, we often are taught to think about all the things people can't do or shouldn't do,
Yes.
rather than what are the things that you want to? What things can you do? And in my
Yeah.
clinical career, I've seen that all the time. Where, like you said, people come in and oh, I'm told I shouldn't play sports again. I shouldn't golf again. I shouldn't, whatever. I got to change my job. I can't go to the gym. Like all these things are told they can't do. And the reason for why they're told they can't do it is usually based on an unsupported premise. This is what goes back to what we were talking about before about these claims are just made and passed on from generation to generation of therapists, and whether it's massage therapists or any other allied healthcare professional, those beliefs that are not supported can create problems in certain populations of people where they're basically told they can't do things. Oh,
Mhm.
because oh yeah, well if you do this, you're gonna ruin your joint or your tissues are too tight, and so therefore if you can't do that because then they're just going to tighten up again and then you're going to feel that same pain. And like there's these stories are made that are so unhelpful, and well-meaning clinicians, I don't think they mean to do it. They
Yeah.
everyone wants to help, I would like to think, and I don't think they're taking advantage. But the knowledge is put into them in school, and it's just perpetuated by an industry that just keeps on feeding all the things people can't do rather than trying to empower. And that's the biggest problem I see, and that's the public suffers from that.
I know. I definitely agree in that sense. Yeah. It's just it sucks to just constantly be telling people that no, you're not gonna eat that life is not gonna be okay. When I do feel like we have such a huge responsibility to teach them what things can they do. Okay, like you have this pathology, you have this condition. Well, what things can you enjoy? And maybe for all you know, maybe there's something that you can do now that can actually progress you to doing something you enjoy that down the road. Like I don't understand why we don't just focus on all like the good things and bring that up to people. It's like you said, like we tend to really focus on all the negative things. We don't talk about what things people can do to make their lives better, or like we don't talk about what things people can do to really enjoy life still. Yeah.
When you were in school and you were, I brought up the evidence-based things and people said evidence, but they didn't really, support it. Did that ever go, like, did they ever talk about critical thinking or any, like, were you ever allowed or encouraged to have discussions about, any, or to be skeptical about anything you were learning, or was it just learn this and accept it?
Honestly, I don't think we were ever really encouraged, but I don't think it wasn't encouraged too. It's kind of like what I was saying before. At that point in schooling, you're just so exhausted that you don't really have energy to criticize things. You don't really have energy to question things. At that point, you're just like, you know what, whatever, I'll just read this, I'll memorize this for now, and I'll just pass the class just so I can make to the next semester, just so I can make to the board exam. And that's part of like why I really don't like the fact that it was difficult. Like I just didn't think it needed to be. I greatly believe that it would have been so much more beneficial if we had a lot more discussion.
Yeah.
Not every instructor. That said, like some instructors were pretty good at having that discussion, but usually at that point, that was already like semester 5, semester 6 out of 6. So you're so burnt out. Like you're so tired. Attendance was so low. Yeah.
You're just done. Yeah.
Exactly. So it's just at that point, like, and speaking for my classmates here, it's just like, okay, you hear this information, that doesn't sound right, but honestly, I just don't care anymore.
Yeah.
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 It's unfortunate. It's very unfortunate.
It is unfortunate, and yeah, I mean things could be better, and that's why I like having these conversations too, is because maybe somebody will listen and they'll be like, hey, you know what, the change is okay. We shouldn't just accept the status quo, and we need to question these things, and that's why I mean that's, I don't know. Sometimes I feel like I'm screaming into the wind, but yeah, we need to have these conversations so people can start to think, hey, like, look, maybe we can change things in school. Maybe we should add this stuff into our program, and we can still put out therapists that are going to pass their board exams. It's not that difficult. And like you just said, right, you get kind of burnt out making it more difficult than it needs to be when you could focus on like good quality discussion and learning. Yeah.
Exactly. And I don't understand. Like at some points, it kind of felt like it was like a badge of pride. Like, oh yeah, I passed a board exam. It was so hard. But then like I would hear stories like we had one instructor who used to be a nurse, and she actually said that her nursing exam was harder than the RMT exam. And that just blows my mind. Like we can't really kill people as RMTs, but as a nurse, right? So why is it like that? Like I genuinely just don't understand it.
Yeah. You probably ask 100 people, you probably get 100 different answers.
Yeah. It is what it is.
So when you were in school, you said you didn't really learn much about evidence-based practice. Did you guys were the kind of the current pain science stuff or biopsychosocial frameworks, were those type of things introduced or discussed at all?
Definitely was. Those things were brought up. Like we learned a little bit about nociceptors, like the anatomy portion of that. But that was also a little bit late. We talked about the biopsychosocial model, but that's another thing where it didn't seem as emphasized as it was. At the end of the day, the whole biomechanical portion was still emphasized. Like these are the orthopedics, this is the pain, like this type of pain that they would have, this is what you do to massage this. But we didn't really talk about what it means to listen to someone. We didn't really talk about what it means to validate people and just hear them out. And it was very much like this is the type of massage you would do for this presentation, as opposed to maybe this person just really needs like some quiet time and just like a nice feeling massage, regardless of whatever technique that you use. As long as they like it, as long as they feel great from it, just go for it.
Yeah.
Like that was never really the topic. It's very much like how do we fix people, essentially.
Is that the fixing mindset rather than that facilitating and kind of coaching and helping mindset.
Exactly. It's like looking at people as if they were cars as opposed to people.
Yeah, and that's a big problem in all kind of MSK education, is that there's still a lot of the programs, or most programs out there, seem to be that fix it, the biomechanical, pathoanatomical solution to everything, and there's a
Yeah.
role for that too. But we know that it's in most cases it's that specific approach isn't that great.
Yeah, and I mean at the same time too, it kind of makes sense because from a logistics perspective, that does seem a lot easier to teach as opposed to like getting the nitty-gritty of like getting to know people, which can be a lot tougher. Like it's just an easier sell to be like, oh, if you have great massage techniques, like you can do this, you can do that, versus you really have to listen to people. Like you're gonna have to go through some hard topics every now and then. Yeah.
Educating people to be uncertain or to be comfortable in being uncertain is not as easy as like pattern recognition.
Yes. Yeah. Like educating people to understand that you're not always going to have the right answer. You're not always going to be the best therapist for that person is very, very difficult. Yeah. And yeah, telling people that you're going to have to be humble is not really the nicest thing to hear. Yeah.
No. No. I mean, it's great though that you felt like you had a decent amount, at least introduction to kind of some of the pain science stuff, some of the biopsychosocial stuff, uh, which is more to be said than a lot of places out there. I've heard good things about Langara though, so some of the people I've talked to from there have said similar things. So I think that's setting that school up more better than some of the other ones, at least in my experiences out there. But you said that like you know near the end of your program you were becoming a little more um, skeptical and things weren't really sitting with you. And I think you reached out to me, didn't you, when you were still a student?
Yes, yes. That was actually the first time I messaged you. I think we were doing the case study, and at that point, I had already seen on social media a few posts by physiotherapists that started talking about the biopsychosocial model in a lot more detail. They were challenging a lot of the beliefs that I held coming from massage school, and it kind of started making me look in terms of, or it started kind of making me look in treatment in terms of more than just the biomechanical aspect. Like, what does it mean to actually have that psychological aspect or social aspect in terms of taking care of someone and what it means for their chronic pain. So I kind of wanted to look more into that, and I asked my case study instructors about it, and they kind of referred you to me, and I started looking into your information more, like your podcast with Jamie Johnson as well, and it just completely like blew my mind in terms of just like, oh my god, like a lot of these things are making sense. Like to me, like this is now actual evidence-based practice as opposed to the very biased, we're only going to look at the evidence that supports us type of evidence-based practice. And that just it just kept on going. Like I started seeing more and more social media posts. I started reading the papers that they were posting. I started talking to other people as well. But yeah, yeah, like definitely it was, I think it was semester 5. We took one class, and a certain claim was made in that class that just made me go like, okay, nope, that's it. I'm done. Like my brain can't handle this anymore. And yeah, yeah. But definitely around semester 4, when we started doing case studies, is when I got to really be introduced by a psychosocial model.
And it kind of opened up a whole new path for you to kind of start exploring and challenging everything. It must be difficult though when you were a student though, and because you're like, okay, I'm learning all this stuff, and then in school I'm learning all this stuff, and these things do not match.
Oh, it was rough. It was so rough. I was so frustrated. I remember just being annoying to my friends. I just kept basically attacking everything. And I hated that I was like that. But I do think part of that is burnout too. Like the feeling that, man, I'm paying so much money for this. And what I'm learning is just not real life anymore. And I felt like I was a little bit duped in a sense because the first few semesters I fully bought in. Like I fully believe that I can sense fascia. Like I fully believe that I can like palpate the SI joint rotation, like things like that. And then I was introduced to a lot stronger evidence that maybe go like, okay, maybe that's not actually the case, which is a hard thing to realize. But after a while, you kind of start realizing, okay, like just because I can't really do those things doesn't mean that I don't have value as a clinician. Like I can be so much more than what I do with my hands.
Yeah, and you said that earlier too, that this one of the biggest problems that people have is that when you start to challenge these claims, people feel it's like a personal attack against them. and it isn't usually, and it shouldn't be, but it's more of a questioning of ideas, or maybe it's an attack on an idea, but I would say it's a hard questioning of an idea that doesn't have support. So, people tend to identify in our profession so much with their modalities and with their narratives behind them, right? You look at most people's websites that are RMTs, they tell you all the techniques they do and all the tissues they work on.
Yeah, exactly. So to be like, for example, like let's say you're a huge craniosacral therapist, like, and you've been doing that for however many years, you've helped so many people already in that sense, and you've seen people get better. And then suddenly a person comes up and goes like, you know what, the narrative actually doesn't match up. Like how would you feel, right? Like to feel like you're probably not gonna feel very great, or you're just gonna go like, this person doesn't know what they're talking about. Like I've done so much already. So it's a hard topic to talk about. And I feel like it was a little bit easier for me to move on from that because I was still a student. So I haven't really had the years of experience to cement my personal beliefs.
Well, and the evidence out there actually supports that what you learn in school, as any healthcare profession, probably any job, but I did a paper years ago on kind of some of the barriers and facilitators for RMTs being able to use and change basically use research evidence in practice. And a lot of the barriers were that people just weren't taught about the stuff in school, right? So the earlier you're taught about skepticism, the earlier you're taught about the principles of like evidence-based practice, the more likely you are to be able to change your beliefs later. That you're more malleable with your beliefs. But if what you
Yeah.
learn in school is a very hard, rigid way, the longer you're in practice, usually the harder it is to change your mind. And I think the data says something like 60% of people won't change their mind if it challenges what they learned in school.
Oh wow.
It's
Wow.
quite significant. Yeah.
Yeah, way more than half.
Yeah.
Yeah, and I feel like that's actually such a just an amazing like small lesson. Just the idea that hey, this is what they're teaching you now, but this is probably gonna change in the future. Like just that little bit of tidbit, I feel like is gonna do wonders for just
If,
like long-term progress.
yeah.
Yeah.
If you had every teacher kind of plant that seed and say, hey, look, guys, like this is what you need to teach you for your board exams. This is kind of what some of the current research says, but this is always good. This stuff's always changing, right? And then just again, that's okay. That's normal. And then that way you're like, oh, okay. So maybe, I can still do these techniques and I can still, help people, but maybe it's not doing what I think it's doing, and maybe I can change my explanation or my understanding, and that's okay. And then it doesn't mean you're a shitty therapist. It just means, hey, like I'm just changing my thinking. And like for me, it was very difficult to unlearn, because I came from a very like fascial structural background. Like that was the stuff I loved, and that's what I practiced for the first, I don't know, half my practice at least. And then when you start to find stuff that is challenging that, and you think, yeah, this makes way more sense than what I thought before. It's hard to unlearn that. And so I know what it's like from both perspectives, and trying to help people or educate people to think differently, but I also know what it's like to be the person to unlearn, because it's very difficult.
Yes. And see, that's the thing though. Like, I don't necessarily believe that there's no space for these modalities. It's more of just there's no space for the narratives that come with these modalities. Like, I think one in particular, for example, like craniosacral therapy. Like, I don't necessarily believe there's a time and place to talk about how the what do you call it? The sutures of the skull are very malleable. You can feel cerebrospinal fluid pumping. Like, I don't think that really makes sense. However, if you have a patient with a highly sensitive nervous system, very scared of touch, is in a lot of pain, they're probably going to be benefiting from a series of techniques that's very soothing and very subtle, right? So and you can basically apply that with literally any other modality that we have. Like we have the ability to help people feel good. Like I don't understand why we don't just capitalize on that. Yeah.
I 100% agree with that. I think that's a great way to summarize all the techniques, right? Is that they're just different ways of working with somebody and interacting with somebody. And I strongly feel that all the different modality camps that are out there, all the different ideas, the different narratives, how can one be right and one be wrong?
Exactly. Exactly.
They all work the same mechanism. So it's just a different way of interacting with a human, and we should just keep it simple. And we shouldn't need these multiple certification levels for these things. And I find that a lot of those modality empires, they're a good business, but they're not necessarily always in the best interests of the therapist or the person getting your care.
And I do find that they kind of contain your ability as an RMT as well. When you start really focusing on the specifics and how to do these modalities, you limit yourself to how often you can use this. Like I feel like if you kind of stop looking at it as I'm gonna do myofascial because this person has like a fascial restriction. If you look at it instead as this person probably likes myofascial techniques and you try it out on them and they like it, who cares if there's these like quote unquote myofascial restrictions, right? Like they clearly like it, keep going for it. So yeah, like I'm not the biggest fan of the modality empires, like you said.
Yeah, it's complicated things. A lot of those modality ideas and narratives, they've complicated manual therapy. Like they've made it more difficult because you have to palpate or do things a specific way. There's a lot of rules associated with them.
Exactly.
I feel creates a barrier to your kind of creativity, or puts a very linear process in your thinking rather than, a more creative kind of whole, I don't want to use the word holistic, but entire person kind of approach, right? We often would just focus with our modalities as like just this very specific way.
Exactly.
Yeah.
Exactly. And again, like as a massage therapist, I just feel like there's so much more we can offer patients than just what we do with our hands. Like the entire appointment is the treatment, and not just whenever they're on the table. Like just simply listening to what they're going through, and especially when they say like, oh yeah, like my doctor said like I can't do this anymore. My physio told me that like my back is weak. And you just going, yeah, that sucks. How do you feel about that? Is already part of treatment. Like I've had some appointments where the first half hour, like we haven't even talked about their pain. They're just talking to me about their day. And like I didn't really know how to like segue into like, oh yeah, so how's that pain coming along? Like they don't like that. Like they just want to talk, right? And they really enjoyed it. I've had some massages where in my head I'm like, this is the worst massage I've given anyone. This is so terrible. But I was just listening to them the entire time and they genuinely loved it.
And I believe there is, well, I'm sure there is. I just can't quote any off the top of my head. So I'm making a statement without any evidence right now, but I know there is some stuff I've read out there, which suggests that, doesn't, whether it's manual therapy, massage therapy, whether it's, medical doctors, whether it's psychologists, social workers, the more connected people feel with you, the better their outcomes will tend to be, or reported outcomes will tend to be, I should say. So for us as massage therapists, we're not dealing necessarily, or we're not dealing at all with, fixing cancer or disease. We're there just to kind of symptom management and facilitating wellness. So if the very least we can do is connect with somebody, the evidence suggests that is actually the most important thing. It doesn't matter what you do with your hands as much. It's got to feel,
Exactly.
it's got to meet their expectations. It's got to help them with, but just connect with somebody.
Yeah, just help people feel nice. Like honestly, that's kind of like my goal with every appointment now, is just overall just be an excellent vibe. Like if you need someone to listen to, if you need someone to rant to, like if you want someone to talk, like if you want to be quiet while I talk about like, I don't know, like whatever I cooked for dinner last night, something like that, like whatever you need. Like if you want to do exercises, I'll do that with you too. Yeah, we just have to have some component of massage, but yeah.
Yeah. Yeah, you're still here for massage, but you're kind of using that environment of the massage to connect and create a kind of therapeutic relationship with somebody, which is great.
Exactly.
There's nothing wrong with it. Yeah, some people might argue and say that that's out of scope, or that's not being okay, but I'm like, you know what? We're supposed to be evidence-based. The evidence suggests that's better than just rubbing a piece of meat on the table. So let's be good humans too, right?
Yeah, and it's not like I'm giving them life advice and telling them what to do, unless it's like specific lifestyle changes. Like, yeah, you should probably go for that hike. Like I still think that's all within scope of practice. We're just listening to people, straight up listening to people and connecting with them.
Yeah, that's totally fine, right? I mean, there's I don't we're allowed to at least here in BC we're allowed to give exercise, we're allowed to give advice as long as with it's in our scope, like and movement exercise is within our scope. So nothing wrong
Hmm.
with that. Nothing wrong. I think that's really good evidence-based practice there.
Yeah.
One thing I just wanted to kind of cycle back to was, we were talking about kind of term 4, term 5. You said you were kind of feeling like you were being an ass and you were burnt out, and you were, you were being a bit of a probably pretty strong opinions to your classmates and to your
Yeah.
instructors. How did they react to the information that you were bringing to them?
I think it's not really something I brought up with a lot of the instructors. Some of them I did talk about, and they were very supportive of that. And those are again like my favorite instructors. They're the ones that were quick to say like, okay, this is what you have to learn because of the board exam, but real life practice, this is how it's gonna be like. They were very receptive of it. With some of my classmates, I want I want to say that like some were actually going like, okay, like that's not bad. Like okay, like I've kind of considered that a little bit. Some of them were very much, well, they were frustrated as well. Like I think at some point some of the things that were brought up like, well, is this really hurting someone? But I do think that some of them are actually changing the perspective too. Like they're starting to realize like, oh, okay, like maybe Dave was onto something there. Like they've talked to other they've talked to the physios that they work with, like the chiros that they work with, who kind of echoed the same thing. Like they're starting to see those papers, those social media posts as well that kind of agree with what I was trying to tell them. So that's nice, but I definitely have to say that at some point within school, I kind of felt fairly alone in that belief, except for a few specific people that I was talking to. Um, yeah, but for the most part, it was a lot of like, yeah, sure, Dave, we got you. We'll listen to you for now. Yeah, and it goes back to I can't really blame them too, because from my understanding, they weren't really saying that or believing that because they didn't believe in me. It's more just they just didn't really have the time or energy anymore to kind of counter what we were learning. And I again like I can't really blame them for that. Here's like here's something that an RMT who's been practicing for like 5, 10 years is telling you, and now your classmate who's learning things with you is telling you no, that person is wrong. Like even if that person gives you evidence, it's a little bit of like, you know what, let's just finish school and we'll deal with this later on down the road.
Yeah.
Yeah.
Well, I commend you though. I mean, it's hard to kind of to stand up and go against the status quo and to even bring and to be open-minded to learn those things. And the fact that you felt alone but still were able to kind of keep wanting to learn, I think says a lot about your character.
Thank
Because
you. Thank you.
yeah, most of us, just kind of we want to just stay with the comfortable, right? With stay with the
Yeah.
with the pack and
Yeah.
just be say what everyone else is saying, do what everyone else is doing, be part of the
Mhm.
norm, and to stand up and say, hey, you know what, this doesn't make sense. This is what I'm reading here, and start to question it and ask and present that information to other people and ask them to question it too. So it is not an easy task, and I think it's great, like in connecting with people like yourself and others I've been able to connect with across Canada and across the world who are very much on the same kind of page as you and I are, and realizing that there's a lot of holes in the profession and in terms of the education, in terms of continuing education and professional development, and seeing there's problems in the schools and the stakeholders and the associations and the colleges, and being able to have these conversations and just to challenge people, needs to happen. Otherwise, we're not going to grow.
Oh, 100%, 100%. It's just surprising because there was a part of me that kind of believed that this circle of people that were more evidence-based was a lot bigger than it was. So coming to actual practice and talking to other RMTs and even physios, I'm like, oh, this is we are a huge minority here. So I do think it is important to just at the very least start conversation because that's how I got started, right? Like I never would have begun looking into these things if it wasn't for your webpage, for your podcast. So it is important. It is important.
Yeah. No, thanks for that,
Yeah.
Dave. I really appreciate that, and that's why I put that stuff out there. Was to just say, hey, people, these are my thoughts. This is kind of some evidence on these things, and to try and get people to pay attention. So that's great. I'm happy to hear that. When I did my first ever continuing education course I taught in 2016, I had people throw things at me, and I had official complaints because at the time, I'll admittedly, like, I probably didn't do a good job. I probably sucked. Like, well, actually, I know it. I was shitty, right? Because I didn't really know what I was doing. I was like, here's a bunch of information, and you're all wrong. I think it's kind of probably how it came across. And I'm humble. I'll admit it. Like, it took a long time, and even now, right? You still do stuff, and you're like, I'm trying to be better. I'm trying to be less wrong.
Yeah.
But the fact that some of the stuff that I was presenting was completely foreign, because people weren't hearing about that stuff. Like, it was new, and I wasn't the only one, but I think I was the one of the first ones that was willing to stand up and put a course on, or teach people about stuff.
Yeah.
That was against the status quo. And there was a lot of years there where people were just so angry and so upset because they felt threatened and challenged. And it's encouraging to me to see that there's other generations of therapists like yourself and others that are out there that are having these conversations, because that's the only way we're going to move forward.
Yeah, it's a slow progress, but it is still progress regardless.
Yeah.
Like, I think the bigger the change, the harder it is to accept, truthfully. And I do feel like a lot of what you're trying to change is a huge 180 from what people believe in. So it's definitely gonna take some time. But I do think that schools have a huge responsibility in being better in this aspect. Because like you said, like, as while people are still students, while they're still learning, I think it's the best time to teach them that, like, hey, this is how you should do research. This is how research can actually affect your clinical practice. And this is how things can change in the future. And this is why that's okay to learn differently down the road.
I love that. The schools have a massive responsibility, but they don't want to accept it. And I know this from my firsthand experience, that talking to many of the schools here, they always want to pass the buck to somebody else. Everyone's pointing a finger at each other. Well, we're not going to change because we have to teach, because these are the recommended textbooks by the college, and everyone is just constantly unwilling to accept that maybe you should take responsibility. Maybe you should bring a different textbook in. Maybe you should educate your instructors to be more evidence-based. Maybe you as a school should change your curriculum a little bit. I know it can be done because I'm working with a school in Alberta right now, which is unregulated, so they don't have nearly as many people telling them what to do. But I'm very comfortable and very confident to say that you can teach a program that's going to get people to pass a board exam and make it evidence-based.
Yeah, exactly.
By putting everything in the right context.
Yeah, exactly.
It's not possible. It just takes work, and nobody wants to do it.
Yeah. It's just easier to, it's so much easier to keep the status quo as opposed to going, maybe it's time to be better.
And that's the responsibility of the schools. You're an educational institute. Don't just do what you've always done. Take some responsibility. Be a leader. If anyone's listening from the school,
hopefully,
you can change it. I know it. It's possible.
The great thing is there is a generation of instructors that are trying to be different, but at the end of the day, they're still instructors as opposed to the entire institution. Yeah. But again, progress is slow. But progress is progress.
Yeah. And the thing is, too, is with the schools is that they don't pay very well.
I heard.
So, I don't know because I don't work at the school, but what I've heard is they don't pay very well. So to get an instructor there, you're probably getting somebody that's passionate and excited to do something, but it's not like a career where, like, say, if you were in a university, you'd have a career educator and researcher.
Yes.
Who their life is dedicated to teaching and researching and trying to create the best content available for their students. Whereas a massage school, it doesn't pay very well.
Yeah.
It's not a career necessarily for most people. Like, it's something they kind of do on the side is, something extra rather than clinical practice. And so you get, it creates a very different mentality with the instructors. So there's gonna be some that are good, But I would
Yeah,
love it if the school said, hey, we're going to hire an entire faculty, and your job is to create, to research, to constantly develop and redevelop a new curriculum. And we're gonna work together. And this is these are the papers we're going to use. These are the textbooks we're going to use. I know it's more expensive,
yeah.
but if you want to create a world-class curriculum, that's what you would probably need to do. You need full-time instructors, and their life was dedicated to education and creating content for their students.
Exactly, absolutely. And I mean, if we're gonna be standing on the same level as physiotherapists, as actual clinicians, like we definitely need to do something better to improve. Like we should stop using textbooks that are, I don't know, 20 plus years old. Actually,
Some of them are
yeah,
from the 90s.
yeah, that
Yeah.
blows my mind. Like some of the things I've read in some of those textbooks, I'm like, wow, this is useless. I'm sorry, but this is completely useless. There's so many things about this was wrong. Like being recommended to use certain essential oils, like very specific amount of essential oils. Like what is this?
Oh
What
wow.
is this?
Yeah, I didn't know that. I've never seen that in a textbook, but that's crazy. So
Yeah.
oils, yeah.
Oh, I heard that I think I read that it's not really a required textbook anymore, but I paid 30 grand for my education, and this book was one of the main ones used for this program. Like, this is ridiculous.
Yeah, 30,000 is a lot of money to spend for something that is not up to date. And that's an issue that a lot of people have, that I've talked to. A lot of students have. They're like, I can't believe I spent all this money for school, and then come out of school and I realized that much of the content I learned wasn't evidence based. And now that being said, is there's a we're I know we're kind of throwing a lot of this stuff under the bus. There's a lot of good content in there, and there's a lot of good
Oh
things to get from school. But we're talking about the negativity bias. We're having a negativity bias with the schooling. It's kind of the topic of this anyway. But yeah,
yeah.
I think we don't want to say it all sucks, but there's definitely a lot of room for improvement.
Absolutely. Yeah. I think on the overall, I don't regret going to school. I think I got a lot out of it. It just so happens that the certain things that I didn't like were just very, very prominent. Like I definitely have made some lasting friendships from that school. Some of those instructors, I do recognize them as huge mentors of mine. They're huge inspirations of just like how to talk to people, like how to treat people as opposed to their body parts. Like I definitely enjoyed my time in Nagara a lot more than I did at SFU for sure. And I was burned out for both of them. But yeah, it's just but I mean that's the thing though. It's like part of that frustration is knowing that they can be better and you want them to be better as opposed to being frustrated like, oh, I hated my time there. Like I love my time there, which is why I want it to be better because I know that it does have that potential.
That's such a great point. I'm glad you said that too, because you wouldn't complain about something, or you wouldn't be, maybe we're complaining, I don't know. You wouldn't be critical of something if you didn't want it to be better. If you didn't care, you're like, I don't flipping care what the hell they do, then you're probably just going to just leave it alone. But
Exactly.
critical, we're having these conversations, we're asking these questions, we're making these statements because we want things to be better, because you care.
Exactly. Exactly.
Yeah. And then that's I hope people are listening. I hope they get that it's a matter of not just because we want to feel like complaining, is because we know that things could be better and there is ways for things to be better. The schools just need to take that responsibility amongst other stakeholders, but I think the schools are the first ones that need to do that.
Yes, especially because every RMT has to go through school, right?
That's the one
Yeah.
thing they got to do. Yeah.
Mhm.
So you have your undergrad, you've been an RMT for 6 months. What are kind of some of your future directions for education or professional development? What are you looking to do next?
Ooh, I definitely at some point want to get a master's. That's definitely something I'm looking into, but that's more like down the road. I really want to have just as much clinical practice and just see as many people as possible. There's like all types of different conditions. Like I love working with people with chronic pain. I do think that I can be a lot more supportive in that sense when I kind of just don't break it down to specific anatomy with them. It's more just like, yeah, like what things can you do with your life right now, and how can we really make sure that you're having a very fulfilling life. Like I love working with those types of patients, so tend to see a lot of like ICBC. I just want to take a lot of courses, truthfully. Like I just want to keep on learning. Yeah, it would be great to be an instructor one day as well, but hopefully when I'm more financially secure, I have a little bit more stability and I'm not working 6 days a week as an RMT.
Yeah.
Yeah. yeah, there's just so many things I want to do. Like I want to do things outside of being an RMT as well. Like just a lot of things.
Yeah.
I just started my social media page. I do plan on putting out more content as well. Like right now it's pretty much blank, but yeah.
Do you want to? Why don't you give everybody a plug for your Instagram page if you want us to get? So maybe we'll get some more followers when this goes live.
Hopefully, yeah. I mean, it's pretty big right now, but it's just dave.rmt at Instagram. And I'm actually surprised that was available too, but that was a friend's suggestion. Shout out to him.
Dave.rmt.
Yeah, nice and simple.
That's so simple.
Right? Completely surprised that's available. But yeah, like the content I'm planning on putting out there is just more directed towards patients as opposed to clinicians, but hopefully that inspires other people to kind of have a much more positive direction towards how they treat people. And again, like not seeing them as cars, but seeing them as people to help as opposed to people to fix. Yeah.
A lot of us, and myself included, like we focus a lot of our content on other RMTs, but there is a huge component, there's a larger component of the public.
Yes.
More so than RMT. So I think that's great that you're looking to develop content out there and hopefully get some followers that will listen or see what you have to say, and hopefully they'll be able to influence them in a positive way to make good decisions about their.
Absolutely.
Yeah. That's great. Well, thanks, Dave, for this conversation today. I really enjoyed that. That was a lot of fun. I appreciate you taking the time from your 3 jobs and your 7-day work week to talk to me for an hour and a bit here. I really appreciate that. So reach out to Dave. You can be found on Instagram at dave.rmt. That's fantastic.
Perfect. Thank you so much, Eric. It was great talking with you.
You too, Dave. Thanks.
All right.
Thank you for listening. If you enjoyed this episode, please give it a 5-star rating and share it on social media. You can follow me on Instagram or Facebook at Eric Purvis RMT. And please head over to my website, ericpurvis.com, to see a full listing of all of my live courses, webinars, and self-directed course options. If you want to connect with Dave, please search for him on Instagram at dave.rmt. So until next time, thanks for listening.